Just a nurse. That's what Dr. Marcus Sterling thought when he first saw her in the ICU hallway at 2 in the morning, moving between patient rooms with the kind of purposeful silence that suggested either competence or invisibility. He hadn't yet decided which. Sacred Heart Hospital hummed around them, fluorescent lights buzzing their electronic prayer, the ventilator in room for 12 wheezing its mechanical rhythm, the smell of antiseptic mixed with something darker underneath it all, something like old bleach and human bodies that refused to stay contained by hospital protocol. Laura Bennett was checking the vitals on a sleeping veteran when Sterling entered. She didn't look up. Her hands moved with the precision of someone who had done this 10,000 times before, finding the radial pulse without searching, reading the monitor display without leaning closer, every motion economical as a surgeon's incision. Sterling watched from the doorway. Her scrubs were perfectly pressed despite the hour. Her dark hair was pulled back so tightly it looked like an act of will. She was 42 according to the staff roster, though something about her posture suggested she carried the weight of someone older, or perhaps someone who had learned very early to carry weight quietly. The veteran, James Coulter, according to the board, stirred slightly when Laura adjusted his full line. She didn't pull her hand back. She simply paused, waiting for him to settle again, her fingers still steady against the 4 tubing. 3 seconds. 5. The man's breathing deepened back into sleep and Laura continued her work as though nothing had interrupted her. Sterling made a mental note. Inappropriate boundary maintenance. Too attached to the patients. The kind of nurse who forgot that hospitals ran on hierarchy and protocol, not sentiment. The kind of nurse who could become a problem if not managed correctly from the start. He turned and walked back down the corridor, his expensive shoes clicking against the linoleum in a rhythm that sounded almost aggressive in the quiet of the night shift. Behind him, Laura finished her charting and did not acknowledge his presence. She never had. 3 years at Sacred Heart and she'd never once approached him at a staff meeting to introduce herself or make conversation. 3 years and she never attended the surgeon's happy hours or the annual gala where the hospital's elite gather to congratulate themselves on their importance. That was what Sterling had noticed first, not Laura's competence, but her absence from every social function that mattered. Absence read as rejection. And rejection irritated him in the way that small things irritate powerful men, not enough to cause real anger, but enough to plant the kind of seed that grows into something darker over time. The night shift at Sacred Heart moved like a different organism than the day shift. The urgent cases were handled by then, the routine crises stabilized, the machines left to their steady beeping while the nurses who preferred silence and solitude moved through the hallways like ghosts who had learned to chart vital signs. Laura had been night shift since day one. The nursing director had remarked on it once, unusual choice, given that most new hires rotated through day shift for at least 6 months before requesting nights. Laura's request had been simple. Professional. No explanation offered. Now, 3 years later, she was an institution. The night shift nurses called her by her first name without quite knowing anything about her. Chen, who worked the station beside hers, had once asked Laura if she had family in Denver. Laura had said yes and continued typing notes without elaborating. Jamie never asked again. That was the thing about Laura, she created a kind of conversational event horizon around herself. People approached with questions and then found themselves moving away without answers, and they weren't quite sure why they'd stopped trying. The break room at 2:47 a.m. contained only Laura and the automated coffee machine that groaned and hissed like a patient in distress. She inserted a pod, waited for the cup to fill, and then brought the mug to the small table where she always sat, alone, in the corner farthest from the doorway. Her hands were shaking. She noticed it the moment the ceramic cup touched her palms. A fine tremor, barely visible unless you were looking for it. The coffee surface rippled slightly, then steadied. She set the cup down on the Formica table and closed her eyes. The tremor wasn't weakness. Laura knew the difference between weakness and hypervigilance, had learned it the hard way in Ramadi when a routine patrol became an IED ambush, and her hands had shaken exactly like this for 6 weeks afterward. This was her body remembering something her mind had tried very hard to forget. This was the cost of falling asleep and then waking again. This was the price of staying alive long enough to make it to Denver and find a hospital and walk through hallways wearing scrubs instead of body armor. She breathed in through her nose, 4 counts, hold, exhale through her mouth for 5. 1 measured breath. Then another. The trembling stopped. By the time she lifted the coffee cup again, her hands were steady enough that the surface was glass smooth. Through the break room window, she could see the parking lot below, rain beginning to hammer the asphalt like distant artillery fire. She watched the drops accumulate, each one indistinguishable from the last, each one part of something larger that the individual raindrop could never fully understand. That was how she'd learned to live, as individual raindrops. 1 shift. 1 patient. 1 vital sign at a time. Nothing that connected to anything else. Nothing that made sense as a larger story. The locker room occupied a corner of the basement near the staff entrance. Fluorescent lights hummed overhead, casting everything in the flat white light that made the world look equally drained and sterile. Laura's locker was third from the end, combination lock marked with a small piece of tape that bore only her employee number. Inside, she kept the regulation items, a change of clothes, a pair of regular civilian shoes, deodorant, a hairbrush. And in the bottom corner, partially hidden by a rolled-up cardigan, a pair of worn tan combat boots. The boots were the kind of detail that nobody noticed because nobody was looking for it. The boots were tan leather, creased in specific places from specific movements, the ball of the foot bent back and forth during crawling, the heel worn smooth from contact with helicopter metal, the sole worn unevenly along the outside edge from favoring a left leg that had been slightly longer than the right ever since a piece of shrapnel had lodged in the femur and decided to stay there forever. A souvenir from a place that gave out souvenirs in the form of shattered bone and permanent limp. If anyone had noticed the boots, they might have asked. If anyone had asked, Laura would have said they were from a hiking trip. The lie was prepared. It was smooth and required minimal elaboration. It was the kind of lie that people accepted at face value because they weren't interested in the real answer anyway. She pulled on her civilian shoes, black leather, sensible, the kind of shoe that a nurse would wear to and from the hospital, and locked the locker without looking at the boots again. That was the ritual. That was the boundary she'd drawn. The boots stayed in the locker, in the dark, where they couldn't be seen and where they couldn't remind her of who she'd been or what she'd survived or what she'd lost when she walked away from a life that had stopped making sense the moment her husband died and she realized that all the medals and commendations and unit citations in the world couldn't protect the people you actually loved. The hospital hallway at 3:15 a.m. was empty except for the machines. Room for 12 was dark, James Coulter sleeping with the kind of deep unconsciousness that only came after heavy pain medication. Laura checked his for one more time, adjusted the blanket over his feet, and moved on to the next patient without any of this showing on her face. 2 hours later, when the day shift began to arrive, when the hospital started its transformation from the quiet world of the night shift to the bright chaos of morning rounds, Dr. Marcus Sterling walked through the doors carrying his new position like a shield. He was tall enough to make the hallway feel narrower. His white coat was pristine. His watch cost more than most people's cars, and he wore it with the casual certainty of someone who'd never once questioned whether he deserved nice things. He'd come to Sacred Heart from Johns Hopkins, where he'd been well-liked by the administration if not quite by the residents, where he'd published 3 papers on surgical innovation, where he developed a reputation for results-oriented thinking and an absolute inability to tolerate incompetence. The nursing staff had been warned. Dr. Sterling expected efficiency. Dr. Sterling did not appreciate excuses. Dr. Sterling would evaluate each team member on their individual merit and would not hesitate to remove anyone from his surgical rotation if their performance was substandard. Sterling made his rounds with his new surgical team, 2 residents and a medical student. He examined patients with the kind of intense focus that suggested he was searching for something specific, something worth his considerable attention. When he reached James Coulter's room, Laura was just finishing the morning vitals. Sterling watched as she removed the blood pressure cuff with efficient, practiced movements. He watched as she noted the reading on the chart without commenting. He watched as she adjusted Coulter's pillows with a gentleness that, in Sterling's assessment, bordered on excessive. "The night nurse seems invested," Sterling said to his resident, Dr. Chen, as they stepped back into the hallway. Chen nodded. Laura's excellent. One of our best. She's too close to the patients, Sterling said. His voice was neutral, but there was something underneath it, the sound of a judgment being formed, a decision being calculated, a man beginning to construct a narrative in his head about who was competent and who was merely competent adjacent. What Sterling didn't see was what James Coulter's family had seen 2 days prior, Laura sitting at his bedside at 11 p.m., when his daughter was finally able to step away for food. What Sterling didn't see was the way the veteran's hand stopped shaking when Laura held them. What Sterling didn't see was anything beyond the surface, because Sterling was a man for whom the surface was usually enough. And what Sterling couldn't possibly have understood, standing there in his pristine white coat with his expensive watch and his newly acquired authority, was that the woman he was watching, the quiet one, the one who never spoke in staff meetings, the one whose hands had trembled that morning in the break room, had once carried a wounded Marine 3 miles through enemy fire. That the woman he was dismissing as possibly incompetent had been called Mercy 6 by the people who owed her their lives. But Sterling didn't know that. What he knew was that he'd found someone to watch. What he knew was that something about Laura's quiet competence made him feel, in some deep way he couldn't quite articulate, like she was operating outside his control. And that feeling, in Sterling's experience, was the first warning sign of a problem that needed solving. The rain continued outside, hammering the hospital windows with the persistence of something that refused to stop until it had changed the entire landscape. And in the basement locker room, the combat boots sat undisturbed in the darkness, waiting. The morning rounds at Sacred Heart began like every other morning, fluorescent lights casting the same sterile glow, the ventilator in room for 12 wheeze breathing its mechanical rhythm, the smell of antiseptic layered under something else, something like desperation and coffee gone cold. Laura Bennett moved through the surgical wing with the kind of invisible presence that allowed her to exist in a space without actually occupying it. 3 years of night shifts had taught her how to move between people the way water moves between stones, necessary, noticed only in absence. But this morning was different. Robert Hayes, the 73-year-old former Marine with shrapnel still migrating near his lung, was crying. Not from the incision, the surgical team had closed him up clean, textbook recovery. He was crying from pain that shouldn't exist in this quantity, in this intensity, post-op hour 16. Laura saw it in how his jaw clenched, how his daughter kept asking the nurses to turn him, how his widow Maria sat rigid in the visitor's chair with the particular helplessness of someone watching their spouse suffer without permission to fix it. She'd seen this before. Ramadi. Forward operating base Shank. The field hospital tent where pain became its own weapon if you didn't manage it correctly. The post-op protocol Sterling had implemented, controlled release morphine every 6 hours with acetaminophen bridges, was adequate for most patients. For Robert Hayes, a man whose nervous system had been recalibrated by combat trauma, whose body had learned to survive on adrenaline and denial, it was insufficient. It was, in fact, cruel. Dr. Sterling swept through the unit on morning rounds at 7:51 a.m., his presence moving ahead of him like the wake behind a ship cutting through water. His white coat was pristine, his stethoscope draped with the casual confidence of someone who'd never questioned his own authority. Behind him trailed the surgical residents, younger, hungry, watching how he moved so they could replicate it, adopt it, become it. Laura waited until Sterling reached Hayes's bedside. "Dr. Sterling, could I speak with you about Mr. Hayes's pain management?" She kept her voice low, deferential, the way a person speaks when she knows she's about to step over a line but believes the line is in the wrong place. His post-op pain scores are running 8 to 9. Given his service history, 3 tours, trauma exposure, I think his pain tolerance may require adjustment to the current protocol. The room stilled. One of the residents, a 4th-year named Chen, actually stopped writing in the chart. Sterling's eyes moved slowly from Robert Hayes to Laura. He was tall enough that the movement required her to look slightly upward, which she did, meeting his gaze with the steadiness of someone trained to stay calm under observation. But Sterling interpreted that steadiness as something else. He saw it as presumption. "I'm sorry, Nurse Bennett, did you attend medical school while working nights?" His voice carried through the room like a physical thing, something with weight and edges. "Or do you just play doctor when real physicians aren't watching?" The residents froze. The attending nurse in the corner suddenly became very interested in a medication cart. Laura took one measured breath. The kind of breath that came from muscle memory, from decades of controlling what could be controlled when everything else spiraled into chaos. Mr. Hayes served 3 tours in Iraq. His pain tolerance is not your concern. Sterling cut her off with the precision of someone who'd learned that interruption was a form of authority. Your concern is following orders, not questioning them. Is that clear, Miss Bennett? Yes, Doctor. Good. Because the next time you undermine my clinical judgment in front of patients and families, you'll find yourself reassigned to a floor where your bedside manner won't interfere with actual medicine. He moved on. The residents followed, already forgetting her. Robert Hayes closed his eyes, his face a map of pain. Maria reached over and squeezed his hand, her own trembling slightly. That afternoon, Laura found Maria in Robert's room. The widow was sitting beside the bed, her shoulders moving in the small, contained way of someone crying who doesn't want anyone to know she's crying. Her purse was open on her lap, tissue scattered like failed attempts at control. Laura said nothing. She simply sat down in the plastic visitor's chair, the one that squeaked when you moved, and she held Maria's hand. Not professionally. Not with the clinical distance of a nurse. Hand to hand. Skin to skin. The kind of contact that said, I see this. I know this weight. You are not alone with this. They sat like that for nearly 4 minutes. Maria's breathing gradually slowed. The tension in her shoulders eased fractionally. It wasn't healing, nothing Laura could do would heal a marriage strained by decades of untreated PTSD and the particular loneliness of being married to someone whose mind had been somewhere else for years. But it was witness. It was acknowledgement. The voice came from the doorway like a sudden temperature drop. Nurse Bennett, this is exactly the inappropriate boundary crossing I warned about. Dr. Sterling stood in the doorway with the hospital's family liaison beside him, his voice projecting into the hallway, into the nurse's station beyond, into the ears of everyone who'd learned to fear his retaliation. You are not a therapist. You are not family. You are a nurse who needs to learn her place. Maria jerked her hand back, embarrassed. Her face flushed. She suddenly looked like she'd been caught doing something shameful instead of something human. Laura released Maria's hand slowly. She stood. She faced Sterling without looking at him directly, a technique she'd learned years ago, a way of maintaining composure while making clear she was not challenging him. She wiped her cheek with the back of her hand. One tear had escaped. Just one. She wiped it without breaking eye contact, without flinching, without giving him the performance he was waiting for. My patients deserve better than your ego, Doctor. The silence that followed wasn't peaceful. It was the silence of people holding their breath. Sterling's jaw tightened visibly, a muscle working in his temple. His hands clenched briefly at his sides. The family liaison looked at the floor. Maria looked at Laura with something like recognition, like seeing someone step into a space she couldn't occupy. Then Sterling turned and left. The liaison followed. And Laura helped Maria adjust Robert's blankets, checked his full line, and made a note to speak with the charge nurse about increasing his pain medication regardless of what the protocol said, consequences be damned. But that wasn't the worst part. The next morning, Laura arrived for her shift and found a document posted on the unit bulletin board. Official letterhead. Her name. Written warning, Laura Bennett, RN. Insubordination. Boundary violations. Undermining physician authority. The handwriting was Sterling's, his signature slashing across the bottom like a blade. She read it once. Her fingers touched the paper for just a moment, feeling the weight of it, the permanence. Then she took it down and placed it in her pocket. If she left it there, everyone would see it, everyone would know, everyone would understand that she'd been marked. By afternoon, the break room had transformed into a geography of absence. When Laura entered with her lunch, a sandwich she'd prepared at home because buying food required a conversation with another person, 3 nurses who'd been sitting together suddenly developed urgent needs elsewhere. Jamie mouthed, "I'm sorry," as she left, genuinely apologetic, but afraid. Sterling had made clear that associating with Laura was a liability, and these were people with families, mortgages, student loans. They couldn't afford to be liabilities. By day 3, Laura stopped trying. She ate in her car. She took her breaks in the supply closet. She performed her duties with the kind of precision that left no room for Sterling to find fault, charting every detail perfectly, following every protocol to the letter, speaking only when directly addressed, her voice always deferential, always small. The final public humiliation came during a family conference in the surgical consultation room. Robert Hayes was in attendance now, discharged but with follow-up concerns. Sterling was presenting the discharge plan and next steps for the migrating shrapnel situation, monitoring, possible surgery in 6 months, activity restrictions. It was thorough. It was adequate. And it was wrong. Laura saw it in the way Robert's face shifted when Sterling described limiting strenuous activity. For a man who'd survived Ramadi by staying active, by moving, by never allowing his body to become a prison, this restriction was a death sentence of a different kind. She'd seen it in military hospitals, seen men wither when told their bodies couldn't do what their minds demanded. "Dr. Sterling," Laura said quietly, "given Mr. Hayes's service history and his particular physiology, might a progressive activity protocol work better? A graduated approach rather than restriction?" The room shifted. Sterling's head turned slowly. "Ladies and gentlemen," he said, his voice carrying that particular quality of contempt usually reserved for insects, "this is what happens when we allow just a nurse with delusions of medical knowledge to participate in clinical decisions. Miss Bennett, you can return to your bedpans now." Robert's daughter flinched. The attending physician looked uncomfortable. Maria closed her eyes as if she might disappear. Laura took one measured breath. She stood. She nodded once, not in agreement, but in acknowledgement of what was happening, what had been made clear, what no longer had room for discussion. She left the room and walked to the locker room. The combat boots sat in the darkness of her locker, waiting. She'd carried them for 3 years. They'd walked through Ramadi with her. They'd carried weight that had no name. She looked at them now, ran her fingers over the worn leather, the scuffed toes, the dust that never quite came clean. That night, she didn't go home immediately. She drove to the cemetery instead. Found the grave with the familiar precision of someone who'd been finding it for 4 years. Knelt in the rain, it was raining now, hammering the Denver streets like something desperate and angry. She pressed her forehead against the cold stone, against the name carved there. "I tried to disappear like you said I should," she whispered. "I tried to just be quiet. Just be invisible. But I couldn't keep quiet when it mattered, and now I've lost everything again." The rain continued its assault against the headstone, against her shoulders, against everything. And in that moment, in that particular darkness, something shifted inside her. Something that had been dormant for 4 years, sleeping beneath the careful construction of anonymity, began to wake. The reassignment papers were in her locker by noon. Geriatric medicine, 3rd floor. Effective immediately. Dr. Sterling's signature was precise, almost calligraphic, the kind of handwriting that suggested someone who believed their penmanship reflected moral authority. Laura read the transfer notice twice, then a 3rd time, as if the words might rearrange themselves into something different. They didn't. She folded the paper and placed it in her scrub pocket, her movements deliberate and careful, the way a bomb technician handles ordnance they know might detonate. The surgical wing was Sterling's kingdom now, and he had just exiled her from it. She didn't ask why. She didn't contact HR. She didn't call the union rep. Instead, she changed into scrubs with the hospital logo, not her shift clothes, but the generic uniform assigned to floating staff, and reported to the 3rd floor at 1,400 hours. The geriatric ward smelled like linen softener and something else underneath, something that lingered in the fabric of places where people waited to die. An older RN named Patricia assigned her to rounds with a kind of cheerful efficiency that suggested she had no idea what was happening downstairs. "You'll love it up here," Patricia said. "Slower pace. Great patience. Everyone's so grateful." Laura nodded and began taking vital signs on a parade of elderly patients whose names she would forget by midnight. But that wasn't the worst part. At 5:05, she checked the surgical board in the break room, a habit she'd developed 3 months ago, a quiet way of knowing which patients she'd be supporting today. The board showed OR for scheduled for 0600. Thoracic surgery. Patient, M. Chen, 28, Lance Corporal, USMC, retired. Procedure, shrapnel removal, migrating projectile fragment, right anterior mediastinal approach. Surgeon, Dr. Sterling, Chief of Surgery. 2 residents assisting. No mention of her name anywhere. She read the name 3 times. Marcus Chen. Lance Corporal. The date of birth was February 17, 1996. She did the math in her head without thinking, the way people counted heartbeats. 28 years old. The math matched. The timeline matched. The name matched. But it couldn't match, because the Marine she'd carried through Ramadi had been 19 years old, bleeding from a femoral artery laceration, his left leg barely attached at the knee, his eyes wide with the kind of shock that came when a body understood it was dying before the brain caught up. She'd carried him 3 miles through a kill zone. Laura's hands were steady as she set down her coffee mug, but her coffee mug was empty, and she'd poured it 40 minutes ago, which meant she'd been holding an empty cup without noticing. She set it down anyway. The fluorescent lights above the break room seemed too bright, casting everything in a flat white that made the world look like a photograph of itself. She could hear the break room refrigerator humming, the ice maker cycling, Patricia laughing at something on her phone 2 rooms away. She thought about walking upstairs to the 4th floor surgical wing. She thought about the protocol. She thought about Sterling's smile when he'd ordered her reassignment. She thought about Marcus Chen's eyes. At 0620, she was supposed to be changing the linens on bed 312, but instead she was standing at the nursing station on the 3rd floor, pretending to document something while watching the surgical board on the monitor. OR4 went live at 0559. The procedure began. She watched the room status change from prep to in progress, each keystroke a small punctuation mark that meant time was moving forward and she was 3 floors away where she was supposed to be. Her hands were doing the work, linens, vital signs, gentle conversations with people who mostly just wanted someone to hold their hand for a moment. But her mind was upstairs, watching a surgery she couldn't see, watching a surgeon she knew would miss something, watching a Marine who had her name written on his forearm in scar tissue and ink, and the kind of gratitude that comes from knowing someone chose you when they could have walked away. At 0847, the code blue alarm sounded from the 4th floor. The announcement came crisp and authoritative through the overhead speaker, code blue, OR4. All cardiac personnel, code blue, OR4. Laura's head snapped up. Patricia was on her feet instantly, but Laura was already moving, her body responding to stimulus in the way that muscle memory responds, not thought, but reflex, the kind of instinct that runs deeper than logic. She stopped herself at the stairwell door, one hand on the push bar, her fingers pressing into the cold metal. She could go up. She could push through that door and take the stairs 2 at a time and be there in 90 seconds. She didn't move. The code ran for 4 minutes. She heard the updates through the paging system, continue compressions. Charge to 360. Check rhythm. The language was calm and practiced because cardiac codes were routine, because doctors and nurses responded to arrest with the same focus they brought to any procedure. But Laura knew what was happening in that OR because she'd been in enough of them to see it clearly, the rhythmic push of compressions, the electrical shock, the medications being administered in the hope that the body would remember how to beat on its own. At 0851, the code was called off. Spontaneous return of circulation, sinus rhythm restored. The words came through the speaker like relief, like reprieve, like the kind of mercy that meant someone got another day. Laura released the stairwell door and walked back to her floor. She finished her shift at 1500 and didn't check the surgical board again. She changed her scrubs in the locker room, closed her locker with the careful attention of someone who was storing something precious, and walked to her car in the parking lot where the April sun was melting the last of the Denver winter. She drove home in silence, radio off, just the engine and the sound of her own breathing, which seemed louder than it should have been, as if her body was trying to tell her something her mind was still refusing to understand. At 17:30, her phone buzzed. A text from Patricia. "Hey, just heard that surgical patient Sterling was worried about. Spike temps this afternoon. Possible infection or another bleed. Dr. Sterling ordered observation only. With choice after a code. You okay?" Laura set the phone down and didn't respond. She sat in her car in the driveway and watched the sun move behind the Front Range mountains, the light turning amber and then red and then a deep purple that looked like a bruise. She thought about Ramadi. She thought about the sound a body makes when it's been hit by shrapnel, the way the field hospital smell, blood and dust and antiseptic, had become her baseline for what normal smelled like. She thought about her late husband saying, "You don't have to save everyone. Someone else will be the hero." She thought about that Marine, 19 years old, looking up at her through the chaos and saying, "Angel, I can't feel my leg," and her saying, "Don't look. Keep your eyes on me. Stay with me." She thought about his forearm, about the tattoo she'd never seen but knew was there because that's what survivors did, they marked themselves with gratitude for people who'd chosen them. At 1800, her pager buzzed. A message from Sacred Heart's patient monitoring system, alert, Chen, O2 saturation declining. Current, 89%. She stared at the message for 5 seconds, then 10, then 30. Normal O2 saturation after thoracic surgery was above 95%. 89 was not a baseline. 89 was a trajectory. 89 was a patient in distress that everyone was politely ignoring because the official decision had been made, observation only, let's see how it resolves. Laura started her car. She was back at Sacred Heart in 12 minutes, moving through the parking lot and into the ER entrance with the kind of purpose that made people step aside without being asked. She took the stairs instead of waiting for the elevator, her footfalls echoing in the stairwell, 2 at a time, not fast enough to draw attention, but purposeful in a way that suggested she belonged. When she reached the 4th-floor surgical wing, she paused for exactly 1 second at the doors, smoothed her scrubs, and walked into the OR hallway with the air of someone returning from a legitimate break. The surgical resident posted outside OR tried to stop her. "You can't," but Laura was already past her, pushing through the OR doors into the controlled environment beyond. The smell hit her first, antiseptic and surgical blood and the particular electrical smell that came from defibrillators and monitors running at high alert. The cold of the room, the way surgical suites were kept so cold it was like walking into a tomb. Dr. Sterling was at the bedside, his hands trembling, his eyes fixed on the monitor where Marcus Chen's oxygen saturation was cascading downward. 88, 87, 86, Sterling's face was the color of old paper. His lips were moving, but no sound was coming out. "He needs immediate decompression," Laura said. Sterling spun, his shock transforming into something sharper. "Get out of my OR." But Laura was already moving, her hand reaching for the crash cart, her fingers identifying the 14-gauge angiocath needle with the kind of muscle memory that didn't require conscious thought. She'd done this before. She'd done this in Ramadi with nothing but moonlight and the sound of gunfire, with a Marine bleeding out and her own hands the only thing standing between him and death. She'd done it in training 100 times. She'd done it in her dreams for 4 years. She didn't ask permission. She didn't wait for authorization. She identified the second intercostal space by touch, the anatomical landmark where the rib met the muscle, where the needle would slip between the ribs and puncture the pleural space. She found it without hesitation. The needle went in. The moment of resistance as it passed through the pleural membrane. Then the hiss, that particular sound, like the exhalation of something that had been holding its breath too long, the hiss of pneumothorax decompressing, pressure releasing, oxygen escape making room for lungs to expand. 40 seconds. That's all it took. Marcus's oxygen saturation began to climb. 87, 89, 91, 94. The heart monitor's rhythm steadied. The surgical resident gasped. The anesthesiologist's eyes went wide. And Sterling's face transformed into something that looked like rage and fear and the particular fury that comes when someone who was supposed to be powerless has just revealed themselves to be absolutely, unmistakably necessary. But that wasn't the worst part. The worst part was that Marcus Chen's eyes were still closed, still sedated, still unaware that the angel he'd been thanking for 8 years was the quiet nurse in the borrowed scrubs who'd just saved his life in his own operating room while the chief of surgery watched in frozen horror. The surgery began at 0600. Marcus Chen rolled into operating room 3 at Sacred Heart Hospital in Denver, his massive frame moving with the careful compliance of a Marine accepting orders. Dr. Sterling stood at the scrub sink, hands already moving through their ritualistic washing, unaware that the patient on his table, the one with the tattoo of a name on his forearm, the name of an angel who'd pulled him through enemy fire, was being delivered into the care of a surgeon whose competence had been slowly, methodically revealed to be theater rather than skill. Laura, reassigned to the geriatric wing 3 floors above, was checking vitals on Mrs. Henderson, an 84-year-old with congestive heart failure, when the overhead speaker crackled to life. Code Blue. Trauma Bay 4. Then the follow-up, all surgical staff to OR 3. Her hand stilled on Mrs. Henderson's wrist. She felt the pulse beneath her fingertips, steady, normal, and whispered an automatic update to her patient before stepping away. But her mind wasn't on the geriatric floor anymore. Her mind was on Marcus Chen, the name she'd heard through the hospital grapevine weeks ago when he'd checked in. Marcus Chen, the Marine from the Ramadi deployment. Marcus Chen, the one she'd carried 3 miles through IED-shattered streets in 2006, his left leg nearly severed at the femur, his consciousness already slipping. Marcus Chen, whose tattoo she'd never seen because she'd been reassigned before he arrived, and she'd made a point of staying away from the surgical wing, away from the possibility of triggering memories that both of them had spent 8 years trying to bury. The surgery proceeded normally for 68 minutes. Dr. Sterling performed a routine thoracic procedure, lobectomy for early-stage lung cancer, textbook approach, nothing unusual. Laura folded linen on the geriatric floor, her hands moving on autopilot while her real attention was anchored somewhere else, a habit she'd perfected over 3 years of night shifts. She could sense the operations below her. Could feel the weight of them like phantom pressure in her chest. The OR staff would be coordinated, precise. The anesthesiologist monitoring gas flow and oxygen saturation. The surgical resident retracting. The scrub nurse anticipating Sterling's next move with the practiced grace of someone who understood his rhythm. Everything running like machinery. Everything predictable. And then at 0729, the machinery broke. The first sign wasn't visual, it was sonic. The overhead intercom didn't crackle. It screamed. Code Blue OR3. Resuscitation in progress. The words punched through the hospital like gunshots, and every nurse on every floor went rigid. Laura's hands froze. The clean folded sheet dropped. Mrs. Henderson, watching her with the clarity that sometimes comes to very old people when something urgent passes through their world, whispered, "Go." Laura didn't argue. She moved. The stairwell doors burst open under her palm, and she was climbing 2 steps at a time, muscle memory from 100 deployments screaming at her that someone was dying, that seconds were collapsing into minutes, that the difference between a save and a body bag was measured in heartbeats. Her boots echoed on the metal stairs, worn combat boots that she'd never had the heart to discard, the leather cracked and faded by 8 years of Denver snow and hospital floors, each scuff mark a memory she couldn't quite access anymore. Ramadi. Kandahar. Forward operating base Shank. Then here. Then nowhere. The transformation was never complete. The OR doors had a code lock, but Laura had memorized it 3 years ago. Her fingers moved. The lock clicked. She slipped through into the surgical hallway, and what she heard through the next set of doors was not the organized chaos of a well-managed code. It was panic. Raw, undirected, the sound of people who'd lost their north and were running in circles. She could hear the ventilator shrieking, the mechanical breath of a desperate machine trying to force air into lungs that something had sealed shut. She could hear the heart monitor screaming a rhythm that was too fast, too frantic, a thing that was already dying. She could hear Sterling's voice, raised but not commanding, the timbre of a man whose authority had dissolved the moment the patient's blood pressure had crashed below 60. Come on, come on. Useless words. Panic disguised as leadership? Laura pushed through the OR doors. The scene registered in fragments. Marcus Chen's chest open on the table, the operative field visible, exposed, the surgical resident, a young woman named Claire whose hands were trembling as she held retractors, looking at the surgical team with wide eyes that screamed for leadership. The anesthesiologist calling out vitals in a voice that had started controlled and was now verging on alarm. Dr. Sterling standing at the table, frozen, his hands positioned as if he was about to do something profound but his body had forgotten how to move. And then Laura's brain caught the clinical detail that explained everything. There, the left lung field, the subtle collapse of tissue where air had escaped from the lung itself and into the pleural space, compressing the lung, crushing the heart, strangling the ability to breathe. Tension pneumothorax. A collapsed lung caused by Sterling's dissection, a tear in the pleural membrane that he'd missed, a complication that was treatable but only if someone acted in the next 60 seconds or the cardiac arrest would become irreversible. Step back. Laura's voice was different in the OR. It wasn't a request. It wasn't tentative. It was a command, the kind of voice that came from giving orders to people whose lives depended on instant obedience. The surgical team turned. Sterling turned. For just a moment, his face registered confusion. Then recognition. Then something that looked like fear. Laura was already moving, hands held for sterile gloves without breaking stride, the muscle memory of 100 battlefield traumas rising up like something that had never actually slept, just been waiting, dormant, patient. She reached the table. She didn't ask permission. Her fingers found the landmark on Marcus Chen's chest, the second intercostal space, mid-clavicular line, the anatomical window where air could escape and lungs could breathe again. A 14-gauge needle in her hand before she'd even formed the conscious decision to ask for it. Claire was handing it to her because Claire could see competence in motion, could see the difference between someone performing medicine and someone who lived it. The needle went in. The hiss of air escaping the pleural space, that specific, unmistakable sound, like the death rattle of pressure being released, filled the operating room. Laura's hands were steady. Steadier than they'd been in 8 years. The oxygen monitor began to climb. 68, 72, 78, 84. Higher. The heart rate began to slow from its panicked 156 down toward something that resembled a sustainable rhythm. The color was returning to Marcus Chen's face, the gray pallor of profound shock giving way to the flush of actual perfusion, actual blood reaching actual tissue. 30 seconds. That was all it had taken. The longest 30 seconds of competence in a room full of people who suddenly understood that they'd been watching the difference between someone who knew how to say the words and someone who knew how to save a life. Laura stepped back from the table. Her hands were perfectly still as she set down the needle. She didn't look at Sterling. She didn't need to. She could feel his collapse happening in the space between them, the way a person's authority evaporates when reality demonstrates that they don't actually possess any. She pulled off the sterile gloves. She turned toward the OR doors. And Sterling's voice erupted behind her, a roar that was equal parts fury and terror. Out! Everyone out except my team. Now! Laura walked toward the doors without acknowledgement. Without hurrying. Without the satisfaction of watching his fear or his rage. The surgical resident called something after her. How did you? That was, but Sterling was already cutting the sentence off, already reasserting a command that meant nothing, already trying to reconstruct an authority that the room had just witnessed him not possess. The walk back down to the geriatric floor took 3 minutes. Laura's hands weren't trembling. That was the strangest part. They were steady. Calm. Like something in her that had been clenched for 8 years had finally released. She'd saved him. She'd done it in 30 seconds in an operating room while the chief of surgery watched. She'd violated every protocol, crossed every boundary, performed a procedure that licensing boards would call practicing medicine without a license, and she'd done it because a Marine was dying and no one else in that room had the competence to prevent it. Mrs. Henderson was watching the door when Laura returned, and the old woman's eyes were bright with knowing. Laura didn't have to explain. Mrs. Henderson simply nodded, and Laura resumed the work of folding linens. But that wasn't the worst part. The worst part was that what she'd done had just ended her career at Sacred Heart Hospital, and she didn't realize it yet. Sterling wasn't angry because she'd shown him up. He was angry because he understood what she'd revealed, not just her competence, but his incompetence, his failure, his fundamental unsuitability for the position he held. And a man like Sterling, a man whose entire identity was constructed around privilege and entitlement and the assumption that authority could never be questioned, wouldn't accept that. Wouldn't process it. Wouldn't acknowledge it. Instead, he would weaponize it. He would spend the next 72 hours constructing a narrative where the needle decompression became recklessness, where Laura became a dangerous liability, where her intervention became the crime instead of Sterling's negligence. He would activate his network. He would make calls. He would ensure that by the end of the week, the woman who'd saved Marcus Chen's life would be removed from the hospital entirely. And the Marine on the operating table would wake up with no idea that the angel in worn combat boots had just been his savior twice in his life, and was about to be made to disappear. Dr. Sterling moved through the hospital corridors with the fury of a wounded predator, his white coat snapping behind him like a cape as he stormed toward his office. The doors hissed closed. Within 20 minutes, his fingers were flying across his keyboard, crafting emails with surgical precision to every board member who mattered, each message a calculated blade, each word chosen to appear measured and professional while describing Laura as a liability. A nurse with a hero complex. Dangerous judgment. Patient safety concerns. Practicing beyond her scope. The emails read like a medical indictment, but they were built on nothing but his wounded pride and the terror that a woman in worn combat boots had exposed him as incompetent. He hit send on the final message at 11:27 p.m. Then he picked up his office phone and began making calls. The fabrication took precision. Sterling had the skills of a man who understood how institutions worked, how they valued documentation, how they moved slowly through proper channels, how they protected their own. He called a hospital in Portland where Laura had never worked and spoke to a department head he'd never met, mentioning casually that he was conducting a reference check on a former nurse. Could they confirm her employment dates? The voice on the other end, confused but cooperative, was honest, no record of Laura Bennett. Sterling made a note in an imaginary file. Called another hospital in Sacramento. Same result. Same note. By midnight, he'd constructed a paper trail of concerns that spanned 3 institutions across the Pacific Northwest. Every reference check came back empty. Every institution had no record of her employment. The absence of a history became the evidence of unfitness. He documented each call, each failed verification, each concerning gap in employment record with a clinical detachment of a man building a case for termination. But the emails alone wouldn't be enough. Sterling knew how boards thought. They needed outside validation. They needed an expert, someone neutral, someone whose opinion couldn't be questioned. He made one more call, this one to Dr. Michael Aldrich, a hospital consultant in San Francisco whom he'd gone to medical school with 23 years ago. Aldrich owed him nothing except the currency of professional courtesy. Sterling outlined the situation carefully, omitting his own role in the surgical error, painting a portrait of a nurse who'd overstepped, who'd endangered patients, who'd shown poor judgment. He needed a consultant's assessment. Just a quick review of her personnel file. A recommendation. Aldrich, trusting his old classmate's framing, agreed to visit Denver within 48 hours. Sterling knew what the verdict would be before Aldrich ever arrived. The hospital administrator, Janet Reeves, sat in her office on the morning of the 72nd hour, the termination letter already prepared on her desk. She'd read Sterling's emails. She'd reviewed the consultant's report. Dr. Aldrich had written a clinical, damning assessment based entirely on the false employment history Sterling had constructed. The board members had weighed in. The consensus was clear. Gross misconduct. Practicing beyond scope. A liability. She signed the letter at 9:33 a.m., her pen moving with the weight of institutional authority behind it, and never thought to question a chief of surgery. The hospital's legal team had already drafted the language. Patient safety had to come first. She picked up the phone and called security. Laura was in the geriatric unit, changing Mrs. Patterson's phone line when the security officer found her. The conversation took 43 seconds. The termination letter was printed on hospital letterhead. Her employment was effective immediately. She was to clear her locker and leave the building within the hour. No opportunity to dispute the findings. No internal review. No chance to explain. The words on the page were clinical and absolute, her career reduced to accusations she'd never had a chance to answer. She read the letter twice, her hand steady, her face revealing nothing, and then she folded it into the pocket of her scrubs. Mrs. Patterson, a 78-year-old widow who'd spent 3 weeks in Sacred Heart, reached out and touched her hand. "You're leaving, aren't you?" Laura nodded. "I have to, sweetheart. But the new nurse will take excellent care of you." She finished the full line with the same precision she'd used for everything else. The locker was emptied in 5 minutes. Clothes. A pair of worn sneakers. Coffee mug from a unit staff appreciation day 3 years ago. And at the bottom, the pair of combat boots, their leather cracked and darkened by decades, the soles worn thin from 1,000-mile marches through Helmand Province and Anbar Province and the streets of Ramadi. She held them for a moment, then placed them gently in the duffel bag that had held her entire life in the hospital. The fluorescent lights above the locker room buzzed with indifference. No one came to say goodbye. The break room was empty when she walked past. Everyone had learned their lesson about associating with Laura Bennett. That night, she drove to Riverside Cemetery on the south side of Denver, the rain beginning to fall as she pulled through the gates. The gravel crunched under her tires. She parked at the section she'd visited 100 times before, each visit a small ritual of maintenance and mourning. The grave marker read, "David Lawrence Bennett, 1978 to 2021, beloved husband and father." She knelt in the rain without hesitation, water immediately soaking through her jeans, the cold stone of the headstone solid against her forehead as she whispered into the downpour. "I tried to disappear like you said I should. I tried to be invisible. I tried to stop being the person who fixes things and saves people. I wanted to just be a nurse, David. Just be quiet and heal without anyone knowing. I failed." Her voice cracked on the last word, the only sound between the headstone and the sky being the hammer of rain on stone and grass and her own breathing. "I couldn't keep quiet when it mattered. When that Marine needed me, when Sterling had already frozen, when there was no one else, I couldn't stay small. And now I've lost everything again. The job, the hospital, the life I was building. And I don't even know if it was worth it because Marcus will never know it was me. He'll wake up and think Sterling saved him, and I've got nothing to show for what I gave up." She stayed in the rain for 20 minutes, her head against the stone, water dripping from her hair, the cemetery empty except for the dead and the woman kneeling among them. When she finally stood, her legs were numb and her scrubs were plastered to her skin, but her composure had returned. She placed her hand on the headstone once more. "I'm sorry, David. I'm so sorry I couldn't keep the promise." Then she turned and walked back to her car, each step measured and deliberate, leaving wet footprints in the grass that the rain would erase within the hour. But that wasn't the end. That was only the end of the first catastrophe. 3 days later, in a glass office on the 14th floor of a federal building downtown, a special agent named Torres sat reading an anonymous email that had arrived in the FBI's tip line. The email contained copies of surgical reports. Dates. Patient names. All redacted except for one, Marcus Chen, admitted to Sacred Heart Hospital on the date in question. The email described post-operative complications that Dr. Sterling had documented as patient error when the surgical record showed Sterling's technique had caused the tension pneumothorax. It showed a pattern, 3 other patients, similar complications, similar documentation falsification, similar outcomes. 1 patient had died. The email was signed only, someone who couldn't stay quiet. Agent Torres forwarded the email to the Hospital Quality and Safety Division. By the next morning, federal investigators were already requesting Sacred Heart's complete surgical archives for the past 18 months. Janet Reeves, the administrator who'd signed Laura's termination letter, received a call from the federal investigator at 2:14 p.m. on a Wednesday. Could she provide Dr. Sterling's complete personnel file and all surgical documentation from the past 2 years? This wasn't a request. It was a subpoena. The color drained from her face as she realized, in the space of a heartbeat, that she'd fired the wrong person. The woman who'd saved Marcus Chen's life in 30 seconds had saved the hospital from liability that would have cost millions. The woman she'd terminated for gross misconduct had exposed a surgeon whose negligence had killed patients. The woman in worn combat boots had done what no administrator, no board member, no quality review had done: she'd stopped the bleeding. The email, the investigation, the surgical records, they would take weeks to fully unwind. But the collapse of Dr. Sterling's career would take only hours once the dominoes began to fall. Like this video if you believe in honoring those who served. If you have military in your family, past or present, we'd love to hear about it in the comments. Subscribe and let's keep going.